there. Welcome to River Talk. There we go. I had a mouthful. I normally say a mouthful. How you doing, Deacon?
Fine. This is a stick-up. Give me all your money.
How do you like the logo? One of our sponsors.
Yeah, it's nice.
Conway Medical
like
Center.
Yeah.
Pretty cool.
Looks good.
I like the logo very much.
I know you do. Yeah, you sport that logo a lot. Dr. Paul Richardson joins us now. How you been, friend?
I've been good, thank you. Been well.
Good to see you.
Yep, good to see y'all as well. Always great to be here.
For those that may not know, he's the Chief Medical Officer at Conway Medical Center. That's a dubious honor.
Dubious, yes.
Yeah.
Dubious, that's right.
You got your hands full with this COVID-19.
We do. Been a while since I've been here. I think we talked COVID-19 last time. So, yep, been a little bit.
Well, last time we were talking, I'm not sure how the numbers were, but I know they've gone up since you were last here.
Yep.
How are we doing right now?
How we're doing right now is actually a fair bit better.
Okay.
We really got super high in numbers, and the community infection rate went way up for us. I mean, I'm again speaking just in Conway numbers, in Conway Medical Center obtained numbers, and but we have seen a really, really nice decrease over the last couple of weeks, both in the number of COVID patients requiring admission, as well as just our overall positivity rate has gone down by about 50%. So that is really good news. A long way from done. Obviously, we can see resurgence like you see with flu seasons or anything like that. But I think we at least have gotten, at least it appears like we're heading in the right direction.
Now, when we get on the other side of this, and I don't know what that's going to look like. I mean, obviously, we still have flus. We have other viruses that are out there.
We sure will.
All the ones that we talked about.
We sure will.
10, 15 years.
We sure will.
Does how we approach this change then?
This is
once the vaccine comes along. I mean,
I think
are we still going to be in the same? Is next year going to look like this year?
I don't think it will. I mean, I think as we get the vaccine, as we get a vaccine, and we have learned a lot. We've learned a ton, but I think as we get a vaccine, that'll help shift us more into quote unquote normal mode, whatever that means. And I think we'll see you'll see less emphasis on maybe hopefully on masking and stuff, because I hate this too. I mean, I don't like doing it, but I do know that it works and it does help decrease transmission.
What's the deal on the eyes? I mean, have you heard this one lately? That you got to protect your eyes too?
Yeah, if you look at absolutely. If you look at the CDC guidelines, we know that there can be transmission through mucous membranes, and our eyes are mucous membranes, and so there is a lot of data, and we are using eye protection at the hospital because obviously, we're front-facing COVID patients every day. And so, especially frontline people are wearing. That's one way to do it too, I guess.
Yeah.
But,
let me ask you this, Doc. All right. Now, what about the 6-foot thing? I can't see you, but what about the 6-foot thing? I mean, we're still wearing masks. I mean, what's the difference now? 6 feet away and still wearing masks.
Yeah. Really, in my personal opinion, the masks are more for the not 6-foot interactions.
Right.
If
we're closer.
Correct.
For
closer, like we are here.
Right.
The closer interactions. So I think people social distancing and masking when they are in close contact is contributing to the decreases we're seeing. That's the only thing I can really attribute it to. We could be also seeing a natural down cycle. Regardless, I'm happy. For whatever reason, I'm happy.
Well, the hand washing thing and having your hand sanitizer, I think, is probably more important if you're wearing a mask. Because obviously I'm up here adjusting all this,
Correct.
and so now my hands are up here around the triangle.
Correct. And it really.
So now the mask makes me touch my face. This is what people are doing.
You
got to keep adjusting it.
It does, but I think it also hammers home about how often we touch our face and don't realize it. See, right now you realize it because you're wearing this mask.
Right.
But normally you're touching your face and you're not realizing it. And so, some studies have shown we touch our face 3,000 times an hour or whatever, or a day or whatever it is. But you're like, that can't be possible. But you do realize it sort of does hammer home when you wear one of these. I do touch my face a lot. I know I'm readjusting my mask, but I do touch my face a lot. But you are correct. The hand sanitizing and all is also effective and helps. Again, because it cuts down on you transmitting it from a surface to your nose, mouth, eyes, mucous membranes where it can be absorbed.
I've always been a hand sanitizer freak.
Oh yeah, he has. I mean, I vouch to that. Yeah.
So much so, these guys are saying you ought to just come up with your own line of hand sanitizer products because I've just always done it.
Right. Well, I mean, and it's a good habit to get in. I don't think any one item is foolproof. I mean, I think it's a combination of items, and some and a mask is better than no mask. That kind of thing. So, I think that as we continue to be vigilant about these things, I think we can see our numbers even go lower and lower and lower. And there's a lot of great vaccine stuff going on right now, and so I do think we'll see one in a not too distant future, but it won't be next week.
No, not going to be next week.
No.
Other hospitals kind of have an initiative going on where you kind of joining forces a little bit right now.
Yeah. That was an idea that we all kind of came up with, that we really wanted to show some unity around what we know is medical fact, and so our chief executive officers got together, issued a joint statement, basically urging the community to mask, social distance, all the things we've been talking about.
And we've got a lot of great hospitals in the area.
Absolutely. One really fantastic one.
Absolutely, call me medical
I
center.
wonder which one that would be.
That one. Yeah,
No doubt.
one
No
really
doubt.
fantastic one. Absolutely.
Oh, now, so you guys are putting your heads together now,
Correct.
So when do you really think that it's going to get? I mean, you just said that you're kind of slowing down now. It's getting a little bit better.
Yes.
50%, you say already?
About a 50% decrease in positivity rate that
Right.
we've seen. We were running for the last couple of months before August. We were running about a low 20% positivity rate, meaning if you tested, it was about a 20% chance that you would be positive. Which, I mean, it was 80% chance I won't be, but in my world, that's a lot. And so now, though, since August 1st, especially, we've seen our positive rates down about 9%, even lower on some days. So that's a dramatic improvement. And usually what that sort of lends to is we're cutting down on our community spread, right? I mean, because not everybody has to come to the hospital. Matter of fact, thank goodness, a vast majority of these patients do not need to be admitted to the hospital.
Right.
But you want to, if you cut down on your community spread, you cut down on your total numbers, you cut down on your hospital admissions, because less people getting it means less people will get sick enough to come to the hospital. So it all kind of, everything sort of follows, along.
Well, now what out in the open? I mean, see, I walk every morning on the beach.
Sure.
And I never wear a mask. It's too hot.
Correct.
So, but and knock on wood, I haven't gotten I don't know if I've ever had the coronavirus. I sure haven't felt bad.
Right.
Since last March. But that's another question. Everybody keeps saying, well, at one point they said, the sun will eliminate it or whatever. I mean, now they've got a question on that.
Yeah,
it doesn't.
There's no scientific back end for that, unfortunately, and right out and open. I didn't run this morning. I like to run a lot of mornings, and I don't wear a mask when I run. I'm out by myself.
Right. Yeah.
But yeah, as a general rule, especially when we're in tight quarters like this, it's a good idea.
Yeah.
I'm blessed. I mean, because the way I deal with people, for the most part, I'm 10 feet from them. I never really noticed that.
That's because Jack doesn't get along with anybody.
No,
so
I
he's
get
only 10 feet
people.
away
It's
from
just-
doing deals. This
And
guy.
it's
Right.
the craziest thing. It's
Right.
unless
Well, it's all
I
right.
do have a lunch meeting
Yeah.
with someone, but
Yep.
just realize that I don't get close to people. But I sure do miss them with this virus
Well,
going on.
in my line of work, we get close to people,
Yeah.
right? I mean,
Oh,
to
yeah.
examine them, to really, be right up there and really take care of them. So it does. We're pretty vigilant about it, obviously, at the hospital. Very vigilant.
Are the numbers for elective surgeries? I mean, there is no business getting back to normal, but are some of the other things happening out there at the
Absolutely,
hospital now?
and actually this week we've opened back up for elective surgery. We're opening back up for some visitation because that's been, I'm gonna tell you, that's been the hardest thing.
Yeah.
I mean, it breaks my heart as a provider. It breaks my heart to have to eliminate visitation, and everybody's sensitive to that. So we feel like our numbers are to the point to where we can safely do that. So we are going to be opening back up for some visitation, but elective surgeries have resumed this week, obviously with precautions. But no, our numbers are still down, but improving overall.
Now, what's this about the story about people who go to the hospital? They may have some underlying condition. If they pass away, they blame it. They say it is the coronavirus. It's not cancer or anything. It's coronavirus killed them. Is that what's with that?
I'm seeing no evidence of that. I've read that as well too online. But I can tell you at Conway Medical Center we're not doing that. I mean, the deaths that are directly attributable to COVID have been attributed to COVID, and those who would not have not.
Right.
So I've read that stuff online too. I don't know what to say about it.
There's so much going on out there. It's got everybody paralyzed.
Correct.
You know what I mean?
Correct. And I've
False
read,
info.
the hospitals are getting paid to do this, that, and the other. I'm on the clinical, not on the financial side, but I can tell you there's no evidence we're getting paid to do anything. So we're just trying to get the job done and do the best for this community.
Well, there's been a big push, and Conway Medical Center has led that charge. When you've gone out into the community and done mammograms and other things out on the mobile side.
Correct.
The best thing people can do is to try and eat healthy and do a little exercise.
Yep.
And that goes so far.
Well, and what we have to remember is I'm afraid people have forgotten, we still have to do, our health maintenance. I mean, even with all this, we still got to get those mammograms, still got to eat healthy, take care of our blood pressure, our diabetes, this kind of thing. I mean, sometimes we lose the forest for the trees here.
Yep.
And I'm afraid that even early on, we saw where people were ignoring some underlying health conditions, non-COVID, and getting in trouble. And we, that's why we want to create a safe environment, which we have, where people can get non-COVID treatment as well.
Sure,
and
absolutely.
I don't want people afraid to come to the hospital because of COVID, because we're still doing great non-COVID work there, and we need to get that word out there.
Yeah. Well, I want people to continue to watch River Talk, but if you're sitting there on the couch because you're not going to work and you're binge watching, all 13 seasons of Heartland or whatever, you do some exercise, get up, move around.
Absolutely.
Call me. I'll put you to work in the yard. Good seeing you, Doc. Thank
Great
you
to
so
see
much.
y'all. Thank y'all for having me. Always fun.
Great. Appreciate the
Chief
mask.
Medical Officer at
It's nice.
CMC, Dr. Paul Richardson. Come on back. We got more River Talk in just a bit.
Oh, yeah.